One of the most common complaints that we see here at Persky Sunder Facial Plastic Surgery is complaints that the upper eyelids are heavy. And one of the really nice procedures that we have to offer those patients is an upper eyelid surgery or upper blepharoplasty. One of the nicest things about the procedure today is that it could be done easily in our office under local anesthesia without having to go to the operating room, without having to undergo anesthesia, and without a long recovery time. The reason for that is today what we've found is that it's really, in the great majority of patients, only necessary to remove the excess skin of the upper eyelid, leaving the muscle and fat behind, because that's good volume. And what we've found over the years is we want to leave volume in the face, particularly around the eyes, to avoid that hollowed out appearance. So many patients are unaware of how easy it is. Basically, the surgery is done here in the office under local anesthesia. We do have the patients have somebody drive them in. They're given a little Xanax and a little bit of Demerol. And the only thing that they feel really is a little pinch of local anesthesia. But once that's done, the procedure takes about 30 minutes on each eye. So after an hour, they're pretty much ready to go home. The stitches stay in place for 4 to 5 days and then come out. And the incision is actually hidden in the natural skin crease. People are always worried about where's that scar going to be. And after a few weeks, it's really hard to tell that anything's been done. And by just removing skin, we give a very, very natural appearance to the eyes without that hollowed out plastic surgical look. So upper eyelid surgery is one of our favorites. It's quick, it's easy, and it's relatively complication-free. The only thing to worry about is maybe a stitch will pop, rarely. There could be a drop of blood. But because it's skin only, the complications that we worried about in the past really are not a problem.